So next up, we go from metadata and private astronauts to digital health, wunderkind and the administrator of the digital health group on LinkedIn that now numbers almost 100,000 people, Paul Sonnier, and Olivier Rabenschlag, the head of creative at Google, one of the relatively unknown digital health leaders who is doing incredible things in digital health every day under the Google brand name, but doing it very quietly. And many people really aren't entirely familiar with it because, again, he just is that kind of person, super humble, like Glenn DeVries, like Paul Sonnier, and many others that are on this program, but very, very humble about it. And then from New York City, our very own April Smith-Hirak, from the Department of Health and Human Services and Northeast Coordinator. And again, another person of great humility. And thank you all for joining us today, Paul. Looking forward to your panel and your interview and learning more about how digital health and human rights is being enabled through all of these phenomenal folks. Olivier, it looks like you have a filter over your camera, by the way, just so you know.
Yeah, I'm trying to make it work. I'm not sure why that is. I'm so sorry.
That's okay, Olivier.
Okay, here we go.
The big reveal. Well, while you work on that, so thank you, Stan. Thank you, Glenn. I'm really delighted to be here. As Stan pointed out, I'm a senior fellow at HITLAB. I'm also the founder of the nearly 100,000 member digital health group on LinkedIn. And I've spent over a decade educating global stakeholders on digital health, in the process creating the digital health meme, not coining the term. So I want to be very clear on that. And I've always been clear on that. It was a disused term at the time that I got a hold of it and changed my group. And, you know, here we are today, everyone talking about digital health. And so the goal has been to catalyze its impact on society. And in my book, The Fourth Wave of Digital Health, I describe how the convergence of the digital and genomic revolutions of healthcare, living, and society is driving a new era of human progress. And it's important to note that human rights and equitable access to healthcare are encompassed within this definition. And this kind of highlights, you know, the whole conference we're having here, Glenn's points that he made. So it's really key that we keep that in mind. And interestingly, I came up with this concept in 2017, preparing for a conference to deliver my keynote at one of Metadata's next conferences, Glenn DeVries' conferences. And so he has a history of both inspiring a book and, of course, writing his own book now, as he mentioned. And also he mentioned at the time that he was intimidated at one point following an astronaut at a conference. And so now I get to follow the astronaut. Thanks a lot, Glenn. So hopefully I'll be in space, 60 miles out in space one of these days. We'll see. So like I said, I'm glad to be here. Delighted to have April and Olivier join me for this panel. And we're going to learn about what they're doing in digital health. And so April and Olivier, can you both give a brief introduction? And let's start with you, April, please.
Sure. Hi, I'm April Smith-Hirak. I'm your friendly regional health administrator from the Federal Health Department. I work out of the Office of the Assistant Secretary for Health, which is in the Office of the Secretary at the Federal Health Department. And we tackle things that are central to public health. So we have the Surgeon General housed in our office, and my job is really a lot of policy, delivery, implementation, translation, to try to work with our jurisdictions, which include New York, New Jersey, Puerto Rico, and the USVI, and to further the policies of our administration. So that means a lot of equity work and a lot of understanding of the lay of the land in digital technology as well.
Fantastic. Olivier?
Well, thank you. Yeah, my name is Olivier. I head up an innovation team out of Los Angeles called The Exploratory. We work across all product areas across Google and Alphabet. And our job is to discover new solutions, new technologies that can eventually have an impact on our world's biggest brand customers. So whatever their critical business challenges are, we want to find solutions for.
Fantastic.
Thanks for having me today.
Yeah, it's great to have you, and you as well, April. So Olivier, let's start with you. Can you give us a couple of examples of your work, and particularly around, healthcare equity and access?
Sure. So the way we operate in our team, we always try and put two seemingly opposite things together to create something new that has never existed before. I can briefly talk about two projects that we are currently working on. The first one being around plastics. And that's in the world of sustainability, because when you think about it, sustainability is very much tied to people's health, especially from a plastics perspective. Our team's dream is to eventually illuminate plastic flows from a data perspective. One of the problems around plastics is that no one really understands where, why, and how plastic travels, and how they leak into the environment through the world's river systems. So we're currently working on a pilot in Asia Pacific, where we really started to get real-time data in what regions, what materials are leaking through what rivers, so that then working with our customers, we can have a better idea on what types of initiatives are needed for us to build to eventually reduce that leakage. And by doing so, also, we are trying to power up an alternative economy to improve people's lives in those regions. And when you think about it, that's the overlap to the healthcare world. So that's one example. Another example is, and Stan knows that example very well, a couple of years ago, we were working with the International Rescue Committee in Somalia on the issue of vaccinations, specifically the flu shot. Turns out 1 out of 8 children under the age of 5 was dying because of vaccine preventative disease, because the healthcare worker had no idea of where the patients were living, because there are no physical addresses. And so we were working with engineers in Zurich to figure out a new system to translate latitude, longitude into 6-digit zip codes. And by including those zip codes into the health records of folks, we were able to track patients. And within a couple of weeks, we gave 10,000 kids a vaccine. So that's a pilot that ran a couple of years ago in Somalia. But those are just two of probably 8 different projects that we currently have in our pipeline.
Yeah, fantastic. And I do recall that project, and the plastics tracking project is really interesting to me personally, because I surf here in LA. We're both in Los Angeles. And so understanding where plastic is coming out into the oceans is, I think, is critical to human health, really, when you think about it. April, similarly, can you tell us a little bit about your work at HHS and how you've tackled equitable access to healthcare, inclusivity, and also social determinants of health?
Absolutely. So, there's a couple sides. We actually have a very long and storied history in equitable access. So we have what we consider the safety net programming for the healthcare system. We at HHS, through our HRSA organization, support federally qualified health centers where anybody of any insurance status can walk in and get healthcare, and it can be free or affordable. So the federal government does have a history of providing that safety net, and we have a number of initiatives and programs that are designed to support that. As we've moved forward, one thing that we've realized is that even beyond the things that we already do, we still have these inequities. And so we as a government are trying to address the inequities in new ways. And that's where technology and emerging innovation in health and healthcare really comes into play for us. So we have this job of being the regulatory body and making sure that our drugs are safe and that your doctors are certified and all of these good things, and that we're not recommending unnecessary procedures. We do all of those things, but what's really important at the federal level is for us to make sure that we're also taking into account ways that we can better increase equity, ways that we can identify where inequities exist, and identifying existing and new and emerging modalities to level that playing field and to really make it so that healthcare access and health achievement and wellness are something that are not determined by your zip code, by the color of your skin, or any other factor other than you being human. So that's where we want to go. And we do that through a number of ways, through the existing programs, through some of our departmental initiatives. We have a lot of innovation initiatives. My office has an innovation office that's hosting a Kidney X activity, trying to grow artificial kidneys, and we've had some really great success in that in the last week.
Wow.
We have some other initiatives and other offices who have always kind of been in this innovation space, and folks didn't always know very much about them, like BARDA, the Biological Advanced Directives and Research Administration. So they have kind of had this job of not just biological protection, but also in helping clinical trials. Often we have clinical trial drop off between phase 1 and phase 2. And getting from that phase 1, phase 2, phase 3 into clinical trials, we lose a lot of novel and developing drugs just because of a lack of investment. And so BARDA is one of our offices that invests in those things. So we have a lot of different ways that we tackle it. And the newest one really is looking at emerging modalities of health delivery and health technology, and how we can incorporate those into our policies and create them in a way that's level and provides equity and equitable access for everybody.
Yeah, fantastic. And maybe we could delve a little bit deeper into that, particularly on the data side. I know we had a conversation yesterday, you, me, and Olivier, about data and the different types of data your organizations use. I think we discussed how you sometimes have lag data at HHS versus Google's data, which is often real time. Can you talk a little bit more about how you leverage data to build solutions?
Sure, you want me to start?
Sure, and then we can go to Olivier. I think that'd be easier maybe.
Okay. So, HHS has tons and tons of data, and we have all different types of data. And the challenge for us is often the way that federal data sets happen, they don't happen in real time. So where Olivier and his organization often will have more real-time data, many times, not always, but many times we do not have that real-time data. So the analyses that we tend to do are a little bit limited by the lag, but what we are able to do, because of the quantity of our data and the breadth of our data, we are able to take a look a little bit more closely. And I think that we have come to an understanding that when it comes to data, you're only as good as what you're analyzing. And so, while we have these huge data sets, if we're not analyzing them with a lens of equity and what we call the social determinants of health, if we're not analyzing for social determinants, then we're not really only getting a small portion of that data picture. So our increase in using social determinants, creating a social vulnerability index, utilizing things like GIS mapping and layering over particular federal data sets are really starting to give us the ability to identify communities where there are particular disadvantages and what the resources are in those communities and how we might be able to strategize better treatment or better access for the communities that are already disadvantaged.
Yeah, that's fantastic. Olivier, can you share a little bit on the data sort of value as you see it and how you're leveraging data, and maybe contrast it a little bit with HHS and the public sector if that's relevant?
Yeah, sure. So the way that my team has been operating is we adopted engineering mindset for innovation, which is build something small in one region, pilot somewhere small, analyze the data, analyze then the insights before we then consider scaling to other regions or other use cases. So the beauty of being at Google, and that's why I'm here after almost 10 years, is because to us data is the magic that should be and can be unlocked to give us the insights to help us design better products for the future. So for some of our pilots, the fact that we hand out 100 phones to waste management organizations in Asia Pacific gives us almost real-time data and insights on human beings, because at the end of the day, my team sits between many different verticals, and it's not like we're experts in every single vertical in the world, but at the end of the day, it's still putting the human being first and the consumer first. And that goes back to human behaviors and having access to data that describes human behaviors allows us to make better products. That's our philosophy, how we've been operating for a while now.
Yeah, and it sounds like you've mentioned, and this is a question I had as well, the partnership aspect to your work, both the work your organizations do. So maybe April, you can touch on the partnerships. I think you mentioned a couple as well as Olivier. So let's go back to you, April. If you'd like to share with us.
So partnerships are the bread and butter of what we do. One of the unique positions of my office is the ability to convene oftentimes seemingly unrelated organizations or stakeholders in order to achieve different solutions. And I think that Olivier and I kind of share that in that perspective in completely different organizations, but it's an interesting similarity that we have. What I find is that in order to tackle some of these issues, we can't just sit around the table with our traditional partners. And so, you know, for us in the government, sometimes that is involving, you know, the emerging technologists, and sometimes it's involving a community-based organization. Sometimes it's outreaching to other parts of the government. Sometimes the government, I know it'll come as a shock, but sometimes we're not as coordinated as we could be. And so some of those meetings are just, you know, saying, well, we're delivering this funding, and what funding are you delivering, and how are we coordinating, and really getting a gross understanding of what's happening across governmental and non-governmental organizations, and then trying to solve for problems. And sometimes you don't even know what problem to solve for until you begin those conversations. So we focus on that a lot.
Well, I think that's interesting when you say, you know, the funding sources and how big your organization is, and, you know, the different, you know, government entities. And so I think maybe Alphabet and Google maybe has some similar challenges there.
I mean, when I think about what we do every day, we'd be nothing without partnerships, both internally and externally. I remember when I first started at Google, I made a commitment, which is every single day, I randomly choose someone within our intranet to reach out to who I've never met before to start building up my network. And those people I still engage with almost every day. And even though those folks are in completely different organizations, different disciplines, whatever, but also externally, it's all about finding shared objectives and shared mission statements. And I think this is what true innovation is all about. Finding those similarities and also keeping it small and keeping it humble and keeping it simple. And I find myself in a position where I talk to certain folks who really don't understand the org that I'm part of or how we operate. It's about translating that in their language to make it meaningful for them. It's all about rallying together like people with the same beliefs. And that's how we've been operating. And that's the same with external partnerships.
Yeah, and well, thank you for that, because I think that does highlight the common mission I think both your organizations share and we all share, which is, you know, improving access to healthcare and equity. And so wonderful job that you're both doing. So thank you for joining me on this panel. I really appreciate it.
Thank you.
Thanks so much for having me. It's been a pleasure.
And
incredible, Paul. And I'd like to ask you, Paul, a little bit about your perspective, because you've got, well, first of all, Paul, thank you for a tremendous interview. Really appreciate you taking the lead and just, you know, just having a great conversation with both April and Olivier, but like to find out your perspective as well, Paul, from all the different stakeholders that you talk to and you read about every day and you write about it every day. Where do you see digital health really being able to get to 8 billion people first? What kind of mechanisms do you think will actually get out to everybody on the planet before anything else does?
Yeah, that's a great question, Stan. So I think, you know, first and foremost, internet access. You know, I still think, I forget the latest stat, but you know, the world is not totally connected to the internet, and of course there's the speed issue. You know, high speed internet can be a lifesaver when it comes to telemedicine. Now, I'm not the expert on this particular area, but to do a telehealth consult with video, you can't just do a simple slow connection. So I would say first and foremost, it's, you know, equitable access to the internet and services that organizations like HHS and Google provide.
Yeah, no, that's absolutely brilliant. So again, thank you all three for joining us today.
Thank you, Stan.
Thanks, Stan.
Thanks, everyone.